I'm here today to talk to you guys about health insurance. I know that you probably don't think about health insurance often. We're young, healthy, and sometimes we feel a little bit invincible. But deep down, we all know we aren't untouchable. We've been through the COVID-19 pandemic, and we know even healthy people can get very sick. Insurance is important, and understanding insurance is an important part of your journey to becoming a responsible adult. Without health insurance, you can lose everything you've worked so hard for. But having insurance can help you afford doctor's visits and the treatment you need if you get sick, are injured, or need mental health care. How can you get health insurance? There are 5 common health insurance options for young adults. Number 1, you may be covered under your parents' health insurance policy, and you may be able to stay on that policy until you turn 26, which is great for most people. Number 2, you may get your insurance through your employer as a benefit of your job. Oftentimes, employers will offer multiple options with different employee contribution requirements and different coverage benefits. It is a good idea to learn more about these options to see if any of the plans make sense for you. Also, if you lost your job, you may be able to stay on the group health plan's COBRA coverage under federal law. Ask your employer or health plan for details. Number 3, you may qualify for Medicaid. Medicaid is a government-funded assistance program for people who meet the income eligibility requirements or have certain health conditions. You may qualify if you are not making too much money yet. Number 4, you can buy your own individual policy through the Maryland Health Connection. And last, if you are a student, you may be able to purchase health insurance through your school. It'll likely be billed to you with your fees and tuition. That's a great solution for many students. But if it's not the solution for you, make sure you are not paying for it. Some colleges and universities require you to opt out of the health insurance they provide and may automatically bill you for it if you have not opted out. So it is a good idea to look carefully at any receipts you receive from the school for expenses. Let's talk about Medicaid and the Maryland Health Connection. The Maryland Health Connection is the state marketplace where individual Marylanders can sign up for health coverage, whether that is Medicaid or an individual insurance policy from an insurer. If you qualify for Medicaid, you will not pay a premium and you will have very few out-of-pocket expenses. If you do not qualify for Medicaid, there's good news for you too. Last year, most Marylanders who signed up for an individual plan on the Maryland Health Connection qualified for financial assistance. So, where do you start? You can visit the marketplace at www.marylandhealthconnection.gov, download their mobile app, enroll MHC, or call them. Open enrollment for individual plans start in the fall, but if you have a qualifying life event, such as turning 26 or losing your workplace health insurance, you may be able to sign up right now. If you qualify for Medicaid, the sign-up process goes on all year long. All you need to get started is a photo ID and your Social Security or individual tax identification number. The Maryland Health Connection has certified navigators available to help you through the application and to answer any questions you may have. They can explain the different plans available and what, if any, costs you may be responsible for. We have lots more information on our webpage if you want to learn more. You can also follow us, the Maryland Insurance Administration, and the Maryland Health Connection on Facebook, Twitter, and LinkedIn.